Hello and welcome back to part 4 of our educational video series that we have branded as our Hygiene Connection. Today I would like to discuss with you the importance of women's oral health and the role that it plays in a healthy pregnancy. I'm sure we can all agree that pregnancy is just a miraculous experience that affects the entire body of a woman, including her oral health. Pregnancy causes many hormonal changes within the woman, and these hormonal changes actually bring an increased susceptibility of the expectant mother to periodontal disease. According to the CDC, 70% of expectant mothers will develop some form of gingivitis. Gingivitis is the first phase of periodontal disease, periodontal infection. It is characterized by inflamed gum tissue, bleeding gum tissue, bad breath, sore gums. If left untreated, it can progress to the second phase of periodontal disease that we call periodontitis, which is a more destructive phase to the oral cavity and to the body. But what exactly are the dangers that this poses to the expectant mother and to her unborn child? Through research and through science, they have found that there is an actual transfer of the bacteria that is linked to periodontal disease, and inflammatory mediators also linked to periodontal disease. As we mentioned in our previous videos, periodontal disease causes a systemic inflammation that goes throughout the body. So through research, they have shown that there's a transfer of these bacterias and the inflammatory mediators across to the placenta, across the fetal membrane, and also into the amniotic fluid. But what danger does this cause to the expectant mother? Well, with the transfer of these bacterias, there are certain conditions that can develop, one being called preeclampsia. Preeclampsia is very dangerous to the expectant mother. If left untreated and undiagnosed, it is characterized by extremely high blood pressure. If left untreated, it can cause damage to the liver and to the kidneys, and also lends to an increased chance of the expectant mother having a stroke. There is also a chance of low birth weight and also preterm labor. When an expectant mother presents with active periodontal disease, it has been shown there is an increase in secretions of what we call prostaglandins. In some of the bacteria that has been linked to periodontal disease, they have found these prostaglandins in the oral bacteria. These prostaglandins are labor-inducing compounds. Also, there is an increase in what we refer to as a C-reactive protein. Whenever there is an infection within the body, the liver kicks in and the liver produces high levels of C-reactive protein. C-reactive protein has been linked to cardiovascular disease. What happens is there's an increase in inflammation, and when this inflammation occurs, it weakens the arterial walls, which can lend to a heart attack or stroke. Also, there's a transfer of this bacteria that goes systemically in the body. When this bacteria is high in the oral cavity, this bacteria travels through the body and it can settle anywhere and create secondary infection and cause other serious illnesses. So you can see how important it is for an expectant mother to stay on top of her oral health care. Even before pregnancy is planned, it's so important just to make sure that physically you are in the best shape. In my many years as practicing as a dental hygienist, I have been asked many times, but is it safe to go to the dentist during a pregnancy? I didn't know I was supposed to do that. I can reassure you it is so safe and so important to see your oral health care provider probably every 3 to 4 months to make sure that that bacteria is being kept at a low level within the oral cavity, so we can ensure overall good health for you and for your baby. So we hope you find these videos helpful, and we invite you to please pass them along to friends, family, so together we can ensure overall health for our loved ones. Take care.